long time ago, but I still remember very well when and how we discussed and planned for NeoKIP project. It was in 2004. We start to think about how to do research intervention in Vietnam to improve newborn care. I think it's a key thing that how to use knowledge into practice.
There was a series of papers in the Lancet telling a really dreadful story about 4 million kids were dying in the first 4 weeks of life every year, and maybe up to 70% of these infants could be saved if we just were using the knowledge and the interventions that we had good evidence for. I think that was how it started.
Yes. And so then we start to do the baseline to collect the own data from the Quang Ninh province. And the highest neonatal mortality happen in the mountainous area, and where there are the people belonging to the minority. And also they have a very difficulty in transportation. And we also found that we have very high home delivery in those remote areas. It's much higher. It's 4 times higher than official data. So we think that we need to do something to improve neonatal health and reduce neonatal mortality.
We had a lot of discussions in the research team, and we decided to test an intervention that would be built on community participation.
We should have local stakeholders, people from the health services, local politicians, and also representatives of the women's union, because all those people were in one way or another responsible for health and welfare in the local setting. And if they met and discussed about the local problems, trying to find solutions to those problems, maybe that could reduce the newborn mortality.
We had the idea about facilitators, someone that should facilitate the improvement process in these groups. And for that we decided to recruit women from the Women Union.
We felt that if we should recruit nurses or doctors to that role, maybe it should be too much of a technical discussion regarding medical matters, much more than initiating processes of change.
Even if this was a strategy that was not really in line with the hierarchical Vietnamese healthcare system, instead this was building on a bottom-up approach with active participation from the local stakeholders. They said, this might work, go ahead and test it. Started to come once a month to work using the PDSI cycle on identifying problems and finding out good activities to solve the problems. We were running it for 3 years with having 90 communes involved. 46 of them were the control communes, which just continued to work as they did before. But in the intervention communes, we implemented this group.
So it's very interesting to see different kinds of problems and different kinds of their solution. Yes.
One problem that I think most of the communes identified really early on was that they needed to support the women in the commune to have more knowledge on how to take care of themselves when they were pregnant and when they were going to deliver, and after delivery how to take care about the infant. I think that was really a prominent problem that many started to work on. How can we inform the women in the commune to better know how to take care of themselves, how to behave when you are pregnant and when you are going to have a baby. We had an intermediate evaluation of outcomes halfway through the project, and at that time we could see no differences between intervention and control communes, and we were a little bit disappointed that it seems that our intervention didn't help at all. But then something happened the third year, because in the third year when we evaluated all 3 years, we could see that neonatal mortality rate, it decreased with about 50% in the intervention communes. But that was 3 years ago, and now this autumn we are coming back to the Quang Ninh province because we want to see what has happened during the 3 years after the trial.
So we're actually doing a follow-up of the trial to see what has happened with the different outcomes, and particularly the primary outcome, neonatal mortality. And that is quite a unique type of project, because people usually stop after doing trials. And now we will follow up and see what happens actually when you leave a project, and if you can see some kind of sustainability, or if things went back to as before.
Before the NeoKIP, 0% of pregnant women have antenatal care in the community health center. But after 3 years, 100% of pregnant women. And now it's still keeping, the result is still keeping and maintaining.
That's very good. Good to hear. Nu ska vi träffa en familj som har ett litet barn och se hur de har det.
They are very poor and they plan to give birth at home. Both Mr. Doe and son, the midwife, came here by motorbike. And Madam Son also says that the first time she came here and tried to convince the mother to come to CSC for antenatal care. She seen refuse and she ran behind the house. And after Mr. Poe explained for her by her language, so she agreed for Madam Son to exam here. They also know that the mother have anemia, so she said, please go quick, because this open 3 centimeters already, and it takes them more than 1 hour to go from here to CSC, even by motorbike, because it's during the night.
And this is quite fantastic results. And we have now published a lot of reports on this. In total, we have published 14 research papers on different kinds of findings.
Yeah. Everybody know about it. We have a guideline, we have material, and we have policy. Yeah, but the implementation is very, very weak. So this kind of research is very much encouraged by Ministry of Health and also at the higher level. Yeah.
With this method, we have 3 good conditions for our activity. That's it's accessibility, it's availability, and it's sustainability. We believe that our activity is very good for our people.
I would like to bring NeoKIP project into other provinces. After 3 years, is the neonatal mortality reduced by half. And now, if you continue with the health facility, I very hoping that. And also, I'm, in my opinion, I'm very strong to believe that it would be reducing more neonatal death. I think it's a good way to encourage people to use their knowledge into practice.